Hi, this is Dr. Daniel Jacobazzi from Fix Me Physical Therapy, and I wanted to talk today a little bit about genetics and the role it plays in health. The reason why this comes up is I had a conversation last week with a patient, and the physician told them, their MD told them that their A1C, high levels of A1C were hereditary, which is something number one, I've never heard before, but number two is so ridiculous that I feel like it probably should be addressed, because she probably can't be the only one that's hearing this. And so A1C is a lifestyle choice, so it's the choices that somebody's making with regards to their food. Some may be a little bit higher than others or lower than others, sure, that's fine, but elevated A1C, hers is almost 7. That absolutely has to do with eating highly processed foods, high amounts of sugar. They're inevitably going to cause a problem, lead to, well, she's already pre-diabetic, but then of course at some point diabetes, and then of course we know up to 50% of people who are diabetic get neuropathy. So that's something that can be squashed immediately, yet the MD chose to tell her that it was a hereditary problem. And the problem with all of this genetics stuff is that genetics are not the sole driver in terms of health. And what I mean by that is we have the choices we make, and of course the environments that we're in. And the reality is genetics, genes are just blueprints. They're maps. They can be turned on or they can be turned off. And so if you have, put quotes around it, bad genes, then all you have to do is make the choices that make sure that those genes don't get activated, and you're going to be fine. I can speak from my personal experience. My family, the one side is very overweight, many of them morbidly obese, and granted, I certainly have genetics from both sides, but I mean, all it would take is some bad choices and failing to exercise at all and totally abdicating any personal responsibility, and boom, I would be overweight and probably pre-diabetic or diabetic. So I think that's one of those things that medicine has done, again, to take the power away from patients, disempower them, make them feel like they're helpless and that there really isn't anything they can do besides rely on medication. And that's not the case. You are in control. And I think probably that's why the program that we use is so powerful, is because we put the power back in the hands of the patients. There's lifestyle training, there's things to do at home, actions that you can take that don't leave you dependent on us for getting better. So you can take it as far as you want to go. And when we talk about the success rates for our program across a little over 500 doctors across the United States, we've got a 97% success rate. Now, I can't speak to the 3%. I don't know if they're compliant. I don't know how much sensory loss they had. I don't know what's going on with them. But even if they were great cases and there wasn't that much wrong with them, 97 times out of 100, success is an amazing result. But all of this, again, I want to bring it back to your genetics do not determine your health. If your parents, your grandparents, your siblings are diabetic, that does not mean that you have to be diabetic type. I mean, obviously there's type 1 and type 2. I'm talking about type 2 diabetes. So you can make choices, you can make changes. The top 5 killers in the United States are lifestyle-related diseases. That means those are choices that we make. And that's the difference in terms of what we do here at this office, is that we tell you we help you see which choices are correct, which ones are going to lead you in the right direction, and give you the result you want. So don't think for a minute just because you have some sort of genetic predisposition to diabetes or heart attack or stroke. By the way, I have all of those, and I'm not worried. That doesn't mean that you're doomed to go down that same road. So all you have to do is make a decision, make better choices, and those genes aren't going to get activated, and your body's going to be healthy and function like it's supposed to. I'll put a link down below for some contact information. We're here to help anybody and everybody who wants it. We're happy to help. That's our goal, to help as many people as possible, especially when it comes related to type 2 diabetes, and of course neuropathy. Thank you for listening. Have a great day, and we hope to hear from you.